Hello, you're all very welcome on this presentation that was given by Dr. John Donlon from Teagasc Grange. He's a research officer in Teagasc Grange, and John gave this presentation at our Teagasc National Beef Conference on the 19th of November, and it's titled "Controlling Pneumonia in Suckler Weanlings." So, just a little bit of background for John. John graduated with a degree in veterinary medicine from UCD in 2018. He went into farm animal practice in Southwest Wales for a year, after which he returned to UCD to pursue a PhD. And he did that PhD specializing in bovine herd health. His research focused primarily on respiratory diseases in dairy calves. During this time, he continued to work part time in a suckler cattle focused veterinary practice in East Clare. And then in 2023, John joined Teagasc as a beef herd health research officer. His very research interest encompasses respiratory disease, calving difficulty, and summer scour syndrome. So thanks very much for this, John, for giving this presentation and for giving it at our beef conference. Um, if you want, you can start sharing there now, John, and we'll get straight into the presentation.
Thank you very much for having me. So, I suppose pneumonia and suckler weanlings, we know that it's a major issue. Previous work, I suppose, done in Grange, when we kind of asked suckler farmers if they had to prioritize animal health issues, it was second only really to dystocia when we started to look at it that way. I suppose in terms of the most recent data on it, the regional vet labs release a report every year where they summarize the post-mortem findings from all the submissions, and it was nearly about half of the animal suckler weanlings that were submitted for post-mortem were diagnosed with pneumonia as the cause of death. So, a major driver of animal losses on farm, and therefore, loss in profit as well. And I suppose, even outside of those losses that you will get from losing an animal itself, there's also well associated losses in terms of live weight gain in those animals that do survive. So it is a very important disease. And I suppose when we talk about pneumonia, and I suppose when I say pneumonia, really what I'm saying is bovine respiratory disease, or BRD. Pneumonia is specifically, I suppose, a disease of the lung, but really BRD is the better thing to call it because it kind of encompasses all of the disease. And so BRD, when we talk about it, there's a couple of different factors that are categories of factors that can influence whether an animal develops pneumonia or what level of pneumonia or BRD is present on a given farm. So I suppose there's animal-based factors. So in our suckler weanlings, what we're really talking about there is the level of stress the animal is under, because we know that stress has a negative effect on the immune system, and we'll go through that a little bit later on in the slides. So that's a significant issue. I suppose every farm will have various pathogens on it that can cause BRD, and we'll discuss all of those different pathogens as well. Not all pathogens are kind of equal. Some can cause more severe disease than others. So depending on the pathogens that are present on the farm, be they viruses or bacteria, you could end up with a situation where there's more animals affected, or more animals affected more severely. So that can explain a lot of the differences between farms. And then I suppose the environment the animal is in as well. And, Ireland, we obviously have a fairly seasonal system. The majority of our suckler calves are born during the spring, so they're getting weaned kind of in the autumn time. And the environment in the autumn is changing. These calves have never really experienced, they've come through a summer, and now they're experiencing their first kind of autumn and winter. So there will be stress associated with, thermal changes and wind and rain as well. And they will in turn kind of have a negative impact on the calves' immune system, and probably also in turn, if we were trying to wean calves in a shed or something, there may be issues with air quality like dust, ammonia, those type of things that can compromise a calf's airway and make them more susceptible to those BRD pathogens. So it's very important to kind of think of all of these things when we're designing a plan to kind of tackle this issue. Keep all of these things in mind. And so, as I mentioned previously, there's bacteria and viruses that can cause BRD. This is data again from the regional vet labs. So we have the most common things that are diagnosed in the regional vet labs are bacteria by far. So M. hemolytica is bacteria, P. multocida, Mycoplasma bovis, and Histophilus somni. The most common virus that was found is bovine herpes virus 1, which is the IBR virus, and then BRSV is the next most common virus found. This data is useful, but I suppose there's a couple of caveats to it. These are all animals that have died that are being submitted. And typically when we talk about BRD in cattle, we speak about it probably being a viral infection to begin with, and then the bacteria kind of coming in as a secondary infection and being the thing that kills the animal. So some of these animals that were diagnosed with M. hemolytica, for example, may have initially had a viral infection, and I'll show you that in the next slide from Grange that would kind of back that up. So I suppose when we move on to the data that we have here in Grange, one of the studies that we did in Grange was essentially bought in suckler weanlings, and then we used new technology, sequencing technology, to take samples from these animals. And these new technologies allow us to be able to identify more viruses and kind of the viruses that you wouldn't typically find maybe if you're using what we call a PCR. And so when we did this on suckler weanlings and we looked at ones that were bought in from marts, we found quite a lot of bovine coronavirus, and we also found bovine rhinitis virus A and rhinitis virus B. And so they were viruses that were essentially not represented at all in the regional vet lab data. And I think that really shows that there's a bit of a disconnect there. And I suppose the common viruses as well, that when we start to speak about vaccines, the viruses that we have a lot of vaccines for, they actually weren't represented particularly well in the data from this particular study, which is interesting in and of itself. So in terms of prevention, like if we're talking about prevention, it has to be a multifaceted approach. You're looking at reducing stress, improving the animal's immunity to pathogens, and then controlling concurrent parasite burden, because I suppose parasite burden would be another issue that we seem to have been seeing cropping up more and more in recent times. And really, at the end of the day, that means that we should have a herd health plan in place for weaning. This isn't something that we should be doing on an ad hoc basis. We should be kind of have these decisions made well ahead of time with regard to things like parasite burden. You will just have to roll with the punches with that. But if you're deciding to vaccinate, then you can make that decision well in advance, especially if you've had previous issues in previous years and you want to do something about it. Then you make that decision and you plan your vaccination schedule well in advance of when you're expecting to wean these animals, essentially. So why is weaning stressful? I suppose there's a loss of contact with the dam. There's a bond there between the dam and the calf, so that is very stressful. There's also a change of diet. These calves up until now will have been drinking milk, so they're going to be going from being able to have quite a nutrient-rich feed to having to rely on their rumen, which will be a change for them. There'll also be a change in environment. Now, as we'll come on to later on, we should try and kind of disentangle the change in environment from the weaning so that we're not compounding stressors. But unfortunately, we can't control the weather, and there will be situations where calves may just have to come in as they're, either just before weaning or at weaning, depending on the weather. We should try and avoid that at all possible. But where, weather gets really bad or something, potentially that would have to happen. And then a lot of farms will obviously sell weaned animals as well, depending on their model. And that in and of itself, the transport, the mixing in mart, they're quite stressful events as well. There'll be kind of assertion of dominance from different animals, bullying, that sort of thing. And I suppose if we say each farm has its own unique kind of group of pathogens, then when you go to a mart, you're mixing a lot of different pathogens from a lot of different animals as well, and exposing animals to pathogens they've never come across before. And then the feed will be unfamiliar, especially if you're coming in off grass onto silage or something like that. So in terms of stress research, what we've done in Teagasc over the years has kind of fairly well confirmed that weaning is stressful. So we've looked at blood profiles, various white blood cells, and other markers that we can use to indicate whether animals are stressed during weaning. And so what we can see here on this particular graph is that neutrophils, being one of the white blood cells in the animals that are weaned at housing, they shoot up. And what that tells us really is if we were to give the animal a vaccine or something, then the animal probably wouldn't respond to that vaccine, and they probably are in a compromised position in terms of if they get exposed to a pathogen, there's a stronger possibility that that will lead to BRD. And the other interesting part about this is there is the control group here were also housed, and we can see that there is a bump in the neutrophil numbers in the housed animals as well. So even housing isolated by itself is a stressor for these animals, and we should be keeping that in mind. And we can see that there are still alterations to the immune kind of system 7 days post weaning. So, it isn't the case that we can just wean the animals and kind of move on and start doing other things to them. We need to give them a bit of time post weaning to cool down and adjust to their new situation as well. And these animals that are, stressed with these higher neutrophil numbers are going to be more susceptible to pneumonia. And I suppose this particular chart is another piece of work that we've done in Teagasc, and these would have been animals that were bought into Grange. And what we can see is that the amount that they're eating, the amount of them that are eating is very low when they first arrive in from mart, and it takes nearly 10 days for these animals to adjust. So when we're buying in calves, we'll say that have been weaned, they will take their time to get used to the environment as well. So we need to be reducing all of the stressors as much as possible and trying to produce calves that are going to be nice and robust when we're selling them so that they can adjust to the environments they're going into. So what are the appropriate weaning procedure? Well, abrupt weaning, as in removing all the cows from all the calves in one go without any feeding or any creep grazing or anything like that, that is a no-go anyway. What we want is gradual weaning and creep feeding, and I'll talk about the rates of creep feeding in the next slide. And we really want to avoid compounding stressors. And I know there's probably a temptation to kind of think about procedures like castration and worming and kind of trying to bring them together to be time efficient, but they're all quite stressful procedures. So if we were to be doing those at the same time that we're weaning the animals, we're really compounding stress, and we're probably really putting the immune system under quite a lot of pressure and really increasing the risk of pneumonia in those calves. So castration, dehorning, those things, we need to probably plan them at least a month in advance. And things like procedures like worming and stuff, look, that should be done ahead of weaning as well. Situations where we'll talk about lungworm a little more later, situations where we think animals need a wormer around weaning, then we may just have to delay weaning a little bit to give the animal a chance after those. So in terms of weaning procedure, feeding meal is going to be very useful. It's going to try and improve the quantity of solid feed that animal has in its diet, and therefore, when we remove milk completely, the animal isn't going to have as much of a shock to the system. It'll be kind of used to eating solid feed, and when it feels hungry, it'll be able to transfer over. So meal feeding for at least 4 weeks prior to weaning, and calves should be at least eating a kilo of meal at weaning to be happy that they're robust and ready for it. And creep grazing is another method, and there's probably double benefits to creep grazing in that if we're offering calves really highly palatable grass in another field that is a little bit, either under a fence or through a creep gate, you're also making them, they'll be more independent of their mother by the time they're being weaned. And so when we're breaking that bond, it'll be less of a stressful event. So it's kind of twofold. You're improving their solid feed intake, and you're also reducing that maternal kind of calf bond. And then I suppose in terms of when we say abrupt weaning versus gradual weaning, what we're really talking about is, rather than removing all of the calves from the cows, first of all, we remove the cows from the calves. So we leave the calves in the field that they're in, and we remove the cows in at least 2 batches. So in groups greater than 10 cows, we're taking them out in 2 batches, and we're leaving kind of 5 days at least in between those groups. And that just means that the entire group isn't stressed at the same time, because BRD is an infectious disease. If you have sick animals, they're going to be shedding the pathogen, and then if you've other animals that are immune compromised, they're more likely to pick it up. So we want to avoid that if at all possible. So in terms of vaccination, I suppose there are a proportion of suckler farmers are vaccinating their calves. And not all farmers are, and I suppose that'll depend on whether you've previously had issues with BRD or pneumonia before. That will often influence your kind of view on it. And I suppose it is a useful tool, but what I will say is it isn't a cure-all. So as I said already, there's several viruses there that we don't have vaccines for. We'll go through the common viruses and bacteria we have vaccines for in the next couple of slides, but you're not going to be protected for everything. If you use a vaccine, you will be protected for the most common viruses that we see in general, and the most common bacteria that we see in general. But really, we still need to be doing everything else right, so that we have a strong calf, so that if something else comes in, they're still protected. And I suppose there's a couple of different types of vaccines. There is your injectable vaccines, and there is your intranasal vaccines. So the injectable vaccines, generally, you probably need to give 2 doses of them, although some of them, if they're a live vaccine, you may only need to give 1. But in general, they need 2 doses separated by 2 to 3 weeks. And then the immunity from them won't really be up and running for another probably 2 to 3 weeks after that. So that's why I'm talking about planning in advance. If we want that immunity up and running for when we're actually weaning the calves, then we need to be injecting the calves with the first injection probably 6 weeks or 8 weeks before that. Some farmers will find they have issues with calves in the shed, maybe if they're calving and the calves are staying in the shed for a little while, and they may start a vaccination protocol in the spring with the really young calves. And those farms, depending on the vaccine they're using, may be able to just give a booster pre-weaning and only have to do that. And we'll say in farms where you maybe haven't thought about vaccination, but you're coming into it now and you're a little bit worried, intranasal vaccines do provide a very useful route there, because intranasal vaccines, they provide rapid protection, so the immunity develops much quicker, because you're stimulating a local immunity in the nose. But I suppose the protection doesn't last as long as the injectable vaccines. And I mean, if these are suckler weanlings you're talking about, you're having to restrain them by the head and kind of squirt these vaccines up their nose to actually stimulate the immunity. And so if you don't have a head scoop and a good head gate, or and even with that, there are still health and safety concerns around that. But I suppose in farms where we've run out of time, they potentially can be useful. The other issue with the intranasal vaccines we'll see is they only protect against viruses. There's no bacterial coverage with them. So if you're trying to do a belt and braces approach where you're trying to cover for as many of the different pathogens as possible, then they won't provide that. Um, and that's why I say plan well in advance. So these are some of the vaccine, or these should be a fairly exhaustive list of all of the vaccines that are available for BRD pathogens in Ireland that are currently licensed. I've left out the IBR vaccines because there's quite a number of them, and they're kind of they're certainly important within the BRD sphere, but there's quite a lot of them, so we've kind of left them out. But essentially, these are the intranasal vaccines, and as you can see, in general, the duration of immunity is about 12 weeks for them, and we can see here that most of them cover for BRSV and PI3, and there's one available for bovine coronavirus as well. So this is some of the injectable vaccines that are available in Ireland, and we can see some of them have a duration of immunity of 6 months, and we can see that the onset of immunity varies between 3 weeks and 2 weeks here, and all of these require 2 doses, and we can see some of them cover for bacteria like Mannheimia hemolytica, and some of them cover for bacteria like Histophilus somni as well. So, and this is a continued list. So I've just kind of included all of the vaccines in this that are licensed in Ireland. And we can see overall, they're all fairly similar in their characteristics of how long they protect the animal for. They're all fairly consistent in terms of how long it takes that immunity to develop after the second vaccine, and the number of doses that are required for all of them. So, we moving on from them, I suppose we have bovine herpes virus, IBR, and IBR is a herpes virus like a cold sore virus that can produce lifelong infection in any animal that's infected with it. And so there's recent work through the National Beef Welfare Scheme looking at the prevalence of IBR in suckler herds, and there's about 50% of herds are infected with it, which is maybe a little bit lower than what we had thought initially. But in terms of what you actually do with that data, essentially with that data, you can decide if you have a high prevalence herd, then probably vaccination is the thing to do. And in general, that's a whole herd vaccination scheme, and you're vaccinating all of the animals in the herd so that over time you're reducing the infectious kind of burden so that the younger calves aren't picking it up, and hopefully over time you'll get to a situation where you have a relatively low prevalence. If you have a low prevalence herd, if maybe only one animal was positive on the beef welfare scheme test, then you potentially could blood the entire herd, pick out the animals that are positive and cull them. Now, for herds like that and for herds that are negative, the big caveat is there is quite a lot of infected herds out there. So really, if you're not running a closed herd, if you're buying in animals, if your neighbor, your fencing between yourself and your neighbor isn't amazing, or there's potential for infection, then pursuing, an IBR-free herd without continuing to vaccinate may be slightly risky, because potentially if you're buying in animals, you could buy in an animal and end up with an outbreak kind of situation there. So for the most part, a vaccination is probably a good idea. There's live vaccines and inactivated vaccines available for IBR, and depending on the vaccine you're giving, it's probably given once every 6 months or once a year, depending on the vaccine. You can give some of those into the nose as well for the younger calves, and most of them will be injectable. So that would be kind of part of a general herd health plan as much as a BRD control plan, but it'll have good kind of consequences for your BRD control as well. So lungworm has been quite an issue this year, according to the regional vet lab. So this is a post-mortem of a calf that was submitted to Limerick Regional Vet Lab. So quite a lot of lungworms, and essentially lungworms and gutworms parasites will have a negative effect on the calf's immune system. But I suppose lungworms in particular for BRD, they're going to detrimentally affect the calf's lungs, and therefore if the calf gets a BRD infection afterwards, it's in a worse state. It's more likely that it's going to have worse kind of consequences. So what we want to do is really identify calves that have coughing at grass, things like that, signs of lungworm, and treat them. We're not going to kind of dilly-dally. We're going to deal with those immediately once we see them, so that they are clear of lungworm when we're going to wean them. If you have calves that are coughing coming up to weaning, then treat them immediately and try and push off the weaning probably like a couple of weeks to give them a chance to recover, rather than compounding those stressors on top of each other. So in terms of coming to the end, I suppose, of this managing pneumonia in weanlings, we can do all of these things right, and sometimes we still will end up with an infection. So what we need to do is look out, have an eagle eye out on these animals when they're being weaned, monitor them 2 to 3 times a day, probably, for those signs of respiratory disease. So rapid breathing, nasal discharge, coughing is a big one. We should always be listening out for coughing when we're walking through groups of animals. And then if you're not happy with an animal, take a rectal temperature. If it's greater than 39.2, consult your vet, and your vet will recommend a treatment protocol. And the key thing is, with all of these things, you will get better results if you identify these animals early. If we are a little bit slow about identifying animals with BRD, there's a higher chance of treatment failure, essentially. And so there are new diagnostic methods coming on track for BRD. One of them is thoracic ultrasound, which is something that I do quite regularly. And so we've done some of this on suckler calves, weanlings in Grange, and it is quick. It's easy to do. A lot of vets will have the probe that they need to do it already, because it's the same one you use for doing pregnancy diagnosis, and it allows us to detect pneumonia that's what we call subclinical. So they're animals that aren't actually showing rapid breathing, they're not coughing, they don't have nasal discharge, they're not really showing clinical signs, and yet when you actually look at their lungs, they have patches of pneumonia in their lungs. Kind of consolidation is what we call it. So this kind of a method allows us to identify those animals and treat them before they potentially start showing clinical signs. So it's quite useful. And this is an example from a suckler weanling of a healthy lung. So if we look here, this is the animal's lung surface here, and we can see there's horizontal lines below it there. This is the body wall, so this is the chest wall here, and then below it we have these horizontal lines. And what those horizontal lines are, they're a thing we call reverberation artifact. They're what you get if a lung is full of air. And if a lung is full of air, then it's healthy, and we should be happy with it. This is an example of a lung lesion that we picked up in a weanling. And so we can see we don't get those nice horizontal lines. We kind of get a patch. If you were ultrasounding the liver, you might think it looks a little bit like the liver. But these patches here, they're essentially small patches of pneumonia where the lung is maybe full of pus and things like that. So we can identify that and then decide to treat those animals. So, there are new diagnostic methods coming online that can be very useful for us in the not too distant future. And I suppose, what do we do in Grange? We have fairly our vaccination protocol actually starts with the young calves. So we start with an intranasal vaccine in the young calves, and we all for BRSV and PI3 we do an IBR vaccine as well. Then we do a subcutaneous vaccine in May that covers for BRSV, PI3, and Mannheimia hemolytica, and that requires a second injection to actually get the full immunity. But we time it so that the second injection we should still have cover from the intranasal vaccine, and so then when we're coming up to weaning, all we actually have to do for those animals is give them a single booster, and that boosts their immunity for that stress period of weaning. So it's quite useful. I suppose the other main things we do is we make sure that these animals are castrated well in advance of weaning, so 8 weeks prior to weaning. We use a creep wire. We feed concentrates for 4 weeks pre-weaning and continue for at least 2 weeks post-weaning. The cows are removed from the pasture that the calves are in 4 separate batches with a kind of a week in between them, and we try and leave the calves out at grass for a couple of weeks post weaning to just make sure they're kind of past that stress period, so that when they get stressed, maybe by going into the house, it's not kind of compounding basically. And we do try and house them when it's a nice dry day and there's a bit of wind there, so that we're getting good ventilation. And then in terms of kind of conclusion, really, I think we can control pneumonia and suckler weanlings. We just need to have a plan in place. We need to be addressing the kind of weaning stress. We need to know how we're going to wean so that animals aren't being stressed. We can use vaccines to help, and vaccines will help, but we can't rely on them solely as a kind of a crutch to not do the other things right. And I suppose we need to keep a very close eye on animals for lungworm, because it is an emerging issue that it seems to be getting worse maybe year on year, really. And if we do those things right, I think, we have a really high quality product at the end of it. We have a calf that's got very high welfare standards. We're not using antimicrobials in that animal, and it's a nice green product that we can sell really well. So thank you very much, and this is our weanlings currently in Grange.
Great, thanks, John. That's brilliant. Okay, that's a really practical presentation there, John. We just have a couple of quick questions before we wrap it up. In that, the thoracic ultrasound, John, that's really interesting. Is that something that you could see more vets getting trained on? I know from other talks we've seen that there's a little bit of training involved in that. Is it something that we're going to see more of in the next couple of years?
Yeah, I hope so. I certainly speak to a lot of vets across the country about it, and there are kind of training courses starting to be set up by other vets. So hopefully, it's something that we're kind of developing an interest in the country, and over time, it won't be overnight, but over time, I think more people will get confident with it and start to use it, because we do have the equipment, so it's quite easy to do.
Good to see. Yeah. In terms of if someone does have a lot of sick calves, and I suppose this comes down to a veterinary decision, or even a small number of sick calves, would it be advisable to get it cultured to see what is causing, or is it something that you just take it? What's your own advice on that?
So I would be a big fan of doing diagnostics and trying to figure out what caused the problem. I think if you have a closed herd, then that gives you a lot of information. Next year, we'll say it'll be probably the same sort of thing causing the problem next year. If you have an open herd where you're buying animals in, then potentially, different things could be coming in next year. But we'll say if you have a herd that isn't responding to treatment the way you want, or things like that, identifying the pathogen that's causing it will explain a lot of that. Because there are certain pathogens like mycoplasma that don't respond to treatment as well.
And that's straightforward enough, John. Is it a swab of the nose or
You can do a swab. The key thing really is probably picking the right animals to do the test on. If they've got big, dirty kind of pussy mucus coming out of their nose, they're probably too far along. Really, you want the lads that are earlier in the kind of stages of disease to swab, and we'd say do a nasopharyngeal swab, which is actually you use a guarded swab that they'd use to swab a mare's uterus or cervix. So it's a bit more of a handling, but it does probably produce more reliable results. And then the other thing you could do is a bronchoalveolar lavage, which is basically you pass a tube down into the animal's lung and wash a little bit of water into it, and then you draw that back out, and you can send that away for testing, and we'll say that'll pick up a lot of the viruses and things. Or if you were worried about lungworm, sometimes you'll actually wash out a lungworm and you'll identify it there and then.
Great, great. Last thing, I suppose, John, in an ideal world, would you like to see the calves fully vaccinated before they were weaned, well in advance of weaning?
Yes. Yeah, I think I would be aiming to have the vaccines on board and kind of well past any of the we'll say onset of immunity kind of numbers that the companies will quote in their documentation. You'd want that done well in advance so that you're happy that the animal is going to be protected as well as it can be. You know, that would be my preferred thing anyway. Maybe it's not possible in all situations.
Yeah, that's perfect. Okay, listen, John, we're going to wrap it up there, and thanks very much for giving that presentation, and thanks for giving it also at our beef conference, which took place on the 19th. Just for the viewers, and that the full proceedings from the conference, so there was a paper for each of the talks, including John's talk here, delivered in that proceedings. So if people want to read a little bit more, there's a few pages there of reading up on it. Also, if you want to see any of the other presentations that were given on the evening, they're all there on the Teagasc website, similar to what we've seen here with John. Listen, thanks a million for that, John, and we'll talk to you again. Thank you.